Okay, my speech today is going to be on oral hygiene and the importance of oral hygiene to your health. Um, Most of you don't know how important it is, and I, to tell you the truth, didn't know before this year started how important it was. But now that I've been studying dental assisting, I found out that it's not only good for your teeth, it's good for your whole body's health. A couple ways to accomplish good hygiene is by brushing at least twice a day, um, and flossing at least once a day. That should help keep your teeth nice without cavities and help you prevent any other kind of diseases that might come along with it. And that comes from the Dental Assisting book by Finney and Halstead. Uh, Another way to accomplish good hygiene or to maintain it is by visiting your dentist every 6 months. For people who have periodontal disease, they will more than likely be visiting their dentist every 3 months because of the regular cleaning that they have to get in order to maintain. Normally, if you've got a 6 month cleaning, you would want to get fluoride treatment. They usually ask you if you want to get it at the dentist's office after your cleaning. I would always suggest to get it. It might be, a couple $100 extra, but it's well worth it because fluoride helps strengthen your teeth. And fluoride is one of the dental materials from the Dental Materials book by Hattrick, Eagle, and Bird. Another way to help you with your oral hygiene is by following a restricted acid diet. The acid in fruits, just regular fruits, strawberries, oranges, even grape juice, that also helps break down enamel, which is bad. You don't want that. Um, any breakdown of enamel can lead to nerve damage, and from there it gets worse. It leads to your jaw, your face, your temporal mandibular joint. It has a lot of effects if you let it go too far. Another way, which would be the fourth, is to lower your intakes on high sugars, candies, juices, soda, anything with high amounts of sugar and carbohydrates, due to the acid breakdown effects that also has on enamel. If you let sugar or carbohydrates sit on your teeth too long, it'll cause a byproduct, which would be the acid, and in return, start breaking down your enamel, causing cavities and further complications. Evidence has shown diabetes and periodontal disease go hand in hand. Periodontal disease is for people who don't like to floss. You may be brushing your teeth twice, 3 times, even 4 times a day, but if you don't get what's in between your teeth, it'll cause periodontal disease. And periodontal disease is the resorption of your jawbone right around here. It gets smaller and smaller as you age. By flossing, you help maintain most of that bone, and once people get that resorption in their jaw, it affects your cardiovascular health and constricts your blood vessels, which are also effects of diabetes. Statistics of this disease shows it's going to affect approximately 450 million people by 2030. And this is I got from Leet, Marlowe, and Fernandez on one of the journals online. And that just gives you a picture of how many people are vulnerable to this kind of disease. Improper hygiene can also lead to other kinds of complications like premature childbirth in pregnant women and heart disease. A third disease caused by improper hygiene would be dental caries. Dental caries may sometimes be visible to the eye. Usually it's when it's gotten too far and you can really see when somebody smiles. But when it first starts, it's invisible, and that's when we start using the x-rays machines. And that is from Dental Radiography book by Iannucci Howerton. The dental x-rays help see the caries in between your teeth because, like I said, most of the time people don't floss in between there, and it's really hard to get to in between your teeth. In conclusion, the effects of improper hygiene are way too many and way too risky for many of you to not take notice or care about it. So my suggestion is pay attention to the amount of people that are out there with dental caries. When they smile, you'll be able to tell. And you should take that as an example to better your health in oral hygiene. And that is all. Thank you.